afternoon and welcome to another episode of the Young Voices Forum. So today you can see that our setup is a little bit different. We are coming to you live from the studios of Red Clay. We today decided to just do something a little bit different, and we even have live studio guests in the studios with us today. So our conversation for today is about abnormal uterine bleeding, and we have Dr. Ramla and Dr. Patience in the studio to answer all your questions. So stay with us. You can invite your friends, share the video so that they can have access to it and also benefit from the discussion. If you have any comments or any questions, you can just leave them in the comment section and we'll get to them when we can. Welcome, Doc. It's nice to have you here.
It's nice to be here.
So, how are you feeling today? I think that we're supposed to actually have a conversation around the International Women's Day. So, how was the day like for you?
Okay. It was quite interesting. That day I was on cover. Okay. So I spent my day practically on the ward. So, and as part of the Medical Women's Association of Ghana theme, we're supposed to, wear our cloth, take pictures, celebrate on the ward. I wore my cloth majestically, went to the ward, hoping to have a rest-filled day, but it wasn't so. It was interesting in the end.
Okay, the observation.
It was a great day. I spent much of the day at home.
Okay.
It's actually a great month for the two of us.
Okay.
It's interesting. On the 6th of March, we both celebrated our birthday.
Oh, belated birthday. Thank you.
Thank you. So, the month of March is actually a great month.
Okay.
It was a great day for me. Restful.
Okay. So that was just by the way. So Doc, today our conversation is abnormal uterine bleeding. Today, this is Women's Month, so I'm hoping that we'll be doing a lot of, women-centered topic or female-centered topic. So when they say abnormal uterine bleeding, what are we looking at? I'll start with Ramla.
Okay. So let's just use the words before we dive into any medical terminologies, and I'm spewing a lot of things. Abnormal uterine bleeding. So abnormal, anything out of the ordinary or out of the normal, and uterine bleeding. So when the uterus is, bleeding, literally producing blood that is not expected out of the normal menstrual cycle.
Yeah.
And it's not associated with any, pathology within the pelvis or out of pregnancy. Yeah. Then you can say, okay, this is abnormal uterine bleeding. But basically, just as the English would, explain it, is any bleeding from the uterus out of the normal or out of the ordinary.
Okay.
Okay. So then we'd want to know what the normal is, right?
Yeah.
So the normal bleeding you expect in a female within the reproductive ages is the menstruation. Okay. And then this usually happens every month. Mostly the cycle length is between 21 to 35 days. So if you have bleeding from your uterus, quite more often than like the 21 days, or it takes more than 35 days for you to bleed again, it's abnormal. And if you can say it's abnormal with the quantity, if it's too scanty or if it's more than the usual. The normal volume of blood that's supposed to come during your menstruation, it's between 30 mils to 80 mils. So if you have less of that or excess of 80 mils, then you can term that as abnormal. Yeah.
Okay, so the 30 mils, 80 mils, like, can you get something to show us? So maybe like,
so, the cup of this maybe approximately 5 mils. So about 6 of this, that's like 30 mils. So imagine you are menstruating and it's less than 6 of this. It's too small.
Yeah.
And then 80 mils, the the pure water sachet is about 500 mils. If you divide that into 5, a little less than 1/5 of that is about 80 mils.
Okay.
So if you are pouring and it's about, that's the size, the quantity of the pure water sachet. That's too much blood to lose every month for every woman. So it's abnormal and we should get it checked.
Okay. So I understand that when it comes to abnormal bleeding, there are types of it. So, like, what are the types?
So, with the types, we have an old classification and then a new classification. What most people are familiar with is the old classification. Where we have terms like oligomenorrhea, that is the scanty menstruation or prolonged. You have more than 35 days before you bleed. And we also have menorrhagia, that's bleeding in excess of the 80 mils I talked about. Some of those terminologies are the past. But then we have a new classification that's the International Federation of Gynecologists and Obstetricians came up with. It's the FIGO classification. And that one, it classifies it as acute abnormal uterine bleeding or chronic abnormal uterine bleeding, and then intermenstrual bleeds. And with that classification too, we have several causes of the abnormal uterine bleeds that are factored into it. So they classify it as structural causes causes that are pertaining to the genital tract. Let's see. So any abnormality in the genital tract of the female that causes abnormal bleeding, and then systemic causes. There are some abnormalities in your body system generally that can cause you to bleed abnormally.
Okay.
So
that's okay. So Ramla, let's pick up from the abnormalities in your body that can cause that.
So I think as part of the flyer, I saw the PALM-COEIN classification.
Yeah,
so
the
that's
PALM-COEIN.
literally
It's what?
PALM-COEIN.
PALM-COEIN.
Or you
I
could
wasn't
pronounce
wrong.
it depending on your English teachers, how you were taught English. So we have PALM for the structural causes and then the COEIN for the non-structural causes. So for the PALM, the P stands for polyps, so polyps in the uterus. So any abnormal growth of the uterine tissue leading to, so polyps, just an abnormal growth of the uterine tissue. We have A for adenomas or adenomyosis, yeah. And then we have L for leiomyomas, commonly known as fibroids. And we have M for malignancies. Literally, a common thing we like to call them is cancers. So cancers within the reproductive system or reproductive tract affecting the ovaries, the uterus, can lead to abnormal uterine bleeding. For the COEIN, which is the non-structural, we have C for coagulopathies. And so there are some people that have either a genetic predisposition or a hereditary predisposition to have, so we have the hemophilias, the other names, the von Willebrand's disease and all that. Not to disturb with their technicalities, but then they have issues when it comes to blood clotting. So they either lack something or they have an excess of a certain factor, making their bodies, their blood, not clot as it would. So we have things like, what's the, PALM-COEIN classification. So C for coagulopathy, O for, I can't seem to recall, but we have I for idiopathic. Now, when we say something is idiopathic, it's usually when we, the health workers, have seemed to we've given you something you did not have initially. Now, that can be as a result of so many things, from medication we have given you, such as anticoagulants, commonly for treatment of certain, conditions. So anticoagulants can cause that. Some intrauterine devices can predispose people to developing abnormal uterine bleeding. Some medications, some people may come and they are on certain medications. Commonly, you have antidepressants being listed as part of the medication that can predispose you to developing an abnormal uterine bleeding, amongst a host of others. The N is for not yet classified. So yeah, there's always room to learn more in medicine. So.
Okay. Our first comment has come in. Ethel is asking if PALM-COEIN is a condition. So I think,
I think it's been sorted out.
Yeah, it's been sorted out. Okay. And then she was asking if it's a lifelong condition or can need be rectified. So I guess Dr. Ramla just explained what the PALM-COEIN is. So we are good over there. So I understand that there is abnormal uterine bleeding and there is dysfunctional uterine bleeding. I mean, coming from an English side, I feel like abnormal is not dysfunctional, you know? But is there a difference between the two? If there is, what are the differences?
Okay, so I'm not far from wrong if you say it's the same, because in some medical literature it's actually used interchangeably.
Okay.
But then the main difference is that abnormal uterine bleeding is sort of like the blanket term. You have a lot of causes, but the dysfunctional uterine bleed, you can't pinpoint an organic cause. You can't really say for sure that this abnormality in this structure is what's causing the abnormal bleeding.
Okay.
Yeah, so that's the difference. With abnormal uterine bleeding, it's a blanket term, it encompasses everything. Then the dysfunctional uterine bleeding, there's no organic cause.
Oh, okay.
That it can be pinpointed to.
Okay. So looking at AUB, what are the symptoms? What are some of the things you are seeing that you can say that, okay, so this is abnormal, this is not supposed to be so?
I mean, Dr. Bacho has actually expatiated on that. I mean, starting from the person's menses. So person comes and tells you, okay, my cycle is usually 28 days. And out of nowhere, it's 21 days, which is not normal for the person. And then, okay, when I bleed, it just drops. Okay. So initially when I started menstruating, it was normal. The next month, I come in, it's just 5 mils. So the lid of the next day is a trickle, and it keeps on like that. And I've been experiencing that for like over 6 months. And you say, okay, that's not normal for you. Let's look into it and find out what.
You are anemic, so we will do a full blood count. And even with a full blood count, we want to know whether it's a systemic cause. So we check your platelets to see whether they are in the normal amounts. And then your white blood cell counts, do they indicate infections or other systemic conditions? The person may also, it's very important to do a pregnancy test.
Yeah.
Because sometimes you think this is my regular menses, but within the last cycle, you probably have had unprotected sex, or for some reason you are pregnant, you don't know. So a pregnancy test is very important. And then you can also do some of the diagnostic tests are abdominal ultrasound or transvaginal ultrasound. That is what it's commonly referred to as a scan. Our people know as the scan. So they can do the scan over your abdomen, your lower abdomen, see if there are some abnormalities, and then even the upper abdomen, they'll check your liver to see if it's okay. And then, but the better option is a transvaginal ultrasound. So they actually put the probe in your vagina to look at the uterus. There are other investigations. So she was talking about the thyroid. So if you think it's the thyroid because of other things you've noticed on examination or from the history, you want to do a thyroid function test to see how the thyroid hormones are.
Okay.
And then you may also want to do other hormonal assays. You want to check the estrogen level, progesterone levels. You may want to check the FSH or luteinizing hormone levels. And then there are a host of investigations to do, but it's all tailored at what the doctor is thinking and what you tell the doctor. So the history and then the examination is very important.
Okay.
Yeah.
So, Dr. Ramla, when it comes to AUB, is there a cure?
So, depending on the cause, we wouldn't be quick to say, okay, this can be cured. And the presentation. To circle back to the questions she asked and what Dr. Butcher was answering to, it depends on how you present. Okay, so if you come to the hospital with AUB and you come and, okay, you are bleeding, you can walk into the hospital. We check you, your vitals are fine. There's no cause for alarm. We'll treat you in a whole different way as compared to somebody who comes in, probably has been bleeding for 5 days, heavily, looks sickly, can barely move. You are an emergency. We tend to you separately. And then to add to it, doctors, we like to talk. We enjoy talking to you, despite all the pressures all around us, because it's the one thing that would lead us to know, okay, this is actually wrong. And so this is just, a call to all of us. Please don't be hiding things when you come to see the doctor, okay? Because when you say, this is what is wrong with me, there are about 5 other things that could be causing that one thing that is wrong with you. And it could be that the very symptom you are hiding is what is going to let us know, okay, this is not so serious. It's just this. And so let's do that. And so, to all of us here, please, the next time you come to the hospital, don't hide it from us. We are not going to judge you. We are not going to talk to us. We are not going
to a priest.
Just bear it all out. Yes, bear it all out. We are not going to, carry your matter else. No, we don't. No offense, but there's barely no time for us to carry, today I got this case, this girl. No, we don't do that. So, to circle back to, yes, is there a cure? For some causes, yes. The structural causes, for instance, if it's a polyp, yes, you can undergo, polypectomy. So we'll take out the polyp. You're good to go. If it's a malignancy, depending on the stage in which you present, malignancy more like a cancer. If you come with endometrial cancer, or if you come with a uterine carcinoma or something, it depends on the stage in which you present. Okay. If you come and it's far advanced, the cancer has left your uterus and is swimming in your lungs or chooses to lodge in your liver or somewhere in your brain, it poses a challenge to the treatment, yes. If you come and maybe the cause is idiopathic, there's probably some medication you were put on, like a contraceptive, like an intrauterine device, like an antidepressant that is tipping you on, and so on and so forth. Or it could be that you're on an anticoagulant. We'll just simply take you off. You're good to go. But if it's others too that require, detailed history and examination, if I come with my menses in my palms, it's a whole different scenario. And we deal with it on a cases basis. So yes, some of them can totally be taken off and then you won't suffer, the issues again. But others, we can manage them.
Okay. So I have a feeling that this is not the end of the conversation, but unfortunately, this is where we have to draw the curtains. I'm hoping that someday, sometime, we can pick up on this conversation again and delve deeper into it. So thank you very much, Dr. Ramla and Dr. Patience, for making time to be with us here today. And a very big thank you to my studio audience who came in today. I am so, so grateful. And also to the technical team, Arafat, Ahmed, and Samuel. Thank you very much. Without them, there will be no Young Voices Forum. So to wrap it up, I am going to go with the words of Dr. Ramla. She says, do not lie to your doctor. And I hear that there are 2 people in this world that you do not have to lie to. One is your doctor, the second is your lawyer. But today, we are dealing with your doctor. So yes, if you are experiencing any symptoms and you go to the hospital, please, please, please do open up so that they can get a cure for you or a treatment plan for you. Also, if you are looking for where to get access to SRH services, be it counseling services, or you have questions that you want to ask, this is a reminder that the Ago She Plus platform exists for you. All you have to do is call and then you get access to a lot of information. If you need to speak to someone who would refer you to any place, be it the medical place or the social services, there is someone that would attend to you. So do call it, share with your friends. If you have any questions on your sexual reproductive health, on gender-based violence, everything, the Dago She Plus call center is the one for you. So this is where we are drawing the curtains. Until we come your way, same time next week, my name is Rahel Entry, and it's bye.